Thank you. This webinar is being recorded and will be posted to our website. This will allow you and others who might not be on the call to refer to it in the future. This webinar is in listen-only mode. You can listen via your computer speakers or your phone using the conference number located in the top right of your screen. You can submit questions at any time using the Q&A box in the lower right corner of your screen. We will answer all questions at the end of this webinar. Now I will pass it on to Joseph Stango and Alex Karoglian.
Hi, everybody. Thank you for being with us today. My name is Alex Karoglian. My pronouns are he, him, or they, them. I'm a psychiatrist based at Fenway Health, and I'm the principal investigator for the Innovative Intervention Strategies 2IS Coordinating Center for Technical Assistance. We very much look forward to you participating in this webinar today so that you can learn more about the opportunity to apply to be part of this initiative. And we look forward to spending the hour with you. With that, I'll turn it over to Joseph Stango at our partner organization, AIDS United.
Hi, everybody. My name is Joseph Stango. I use he, him pronouns, and I'm a senior program manager at AIDS United, working with our colleagues at the Fenway Institute as part of the 2IS Coordinating Center for Technical Assistance, or the CCTA. Very excited for you all to learn about this exciting initiative, and I hope to be working with some of you very soon. And with that, I'm going to pass it back to my colleague, Ms. Hill.
Thank you, Joseph. And here's an overview of today's webinar. We will discuss the summary of funding as it relates to this funding opportunity. You will meet the respective teams under the Coordinating Center for Technical Assistance, CCTA, followed by an overview of the funding opportunity, learn about the 4 focus areas of the interventions. You will then hear about the eligibility. Finally, you will hear about the site selection process, how to apply, and the timelines, and closing with giving you an opportunity to ask any question. And now I'll pass it over to Alex.
Thank you, Marcel. This project is supported by the Health Resources and Service Administration's HIV/AIDS Bureau. So HRSA-HAB is our supporter and funder for this work in the U.S. Department of Health and Human Services under grant number U90HA42153. The National Training and Technical Assistance in this project is funded for the amount shown here, and none of it is financed with non-governmental resources. The information or content and conclusions are those of our organizations involved here and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the US government. I'll turn it back over to Joseph and Marcel.
Thank you so much. And now let's meet the CCTA team. Here we have the CCTA team per agency and our roles. The Fenway Institute is the recipient of the grant and have contracted with us, AIDS United, to be the sub-partners in this initiative. Collaboratively, we will work on providing technical assistance to the awarded sites and oversee all the phases of this initiative. The Evaluation Center, spearheaded by the University of California, San Francisco, will oversee and support the evaluation component of this initiative. And with that, we'll pass it to Alex.
Thanks, Marcel. I'll say a word about the Fenway Institute, which is the prime recipient of the 2IS CCTA cooperative agreement. We're a federally qualified health center based in Boston, Massachusetts, founded in 1971. This is our 50th anniversary in 2021. From the beginning, Fenway has been focused on providing the highest possible quality care for sexual and gender minority people. And we are now the largest provider of HIV services in New England and a Ryan White HIV/AIDS program funded healthcare organization. We serve over 2,300 people living with HIV in primary medical care each year. We're also the largest provider of transgender health services in New England, serving over 4,000 transgender and gender diverse people in primary medical care each year. We have an institute within our federally qualified health center, the Fenway Institute, that focuses on research, education, training, advocacy, and policy. And this is where the 2IS CCTA is based. And I'll turn it back over to Joseph and Marcel.
I'll pass it back to you.
This is still me. Okay. Here are the members of our team at the Fenway Institute as part of the CCTA. I'm principal investigator. Chris Grasso is our Director of Telehealth and Technology. Ken Mayer is our Director of HIV Intervention Strategies. Sean Cahill is our Policy Director. Hillary Goldhammer, whom I believe is on right now, is our Curriculum Director. Milo Dorfman is also on right now, is our Program Manager. Sarah Mitnick is our Director of Program Operations. Mason Dunn is our Communications Director, and Brian Shapiro is our Program Assistant.
Thank you, Alex. And now we'll talk about AIDS United. Who are we? AIDS United's mission is to end the AIDS epidemic in the United States through strategic grant making, capacity building, policy, technical assistance, informative research. Led to charge for the responsive and effective federal, state, and local policies that benefit people living with and at risk of HIV. Invest in innovative models to meet the needs of communities affected by HIV/AIDS, and launch strategic grant-making initiatives that have directly funded more than $104 million to local communities and have leveraged more than $117 million in additional investments for programs that include but are not limited to syringe access, access to care, capacity building, HIV prevention, and advocacy. And how do we do it? We advance advocacy based on sound public policy, strategic grant making to affected communities, targeted and tailored capacity building for organizations responding to the epidemic, and research and evaluation to inform the field. We work within a social justice framework that challenges the foundational issues of racism, sexism, homophobia, and transphobia, socioeconomic inequality, gender discrimination, and stigma. The AIDS United Coordinating Center for Technical Assistance team consists of Alicia Downs, Director of Programs, Joseph Stango, Senior Program Manager, myself, Marcel Miranda, Program Manager, and Brian Thomas, our Program Associate. And the Evaluation Center from the University of California, San Francisco, will be working with CCTA, and some of the staff members are here with us, but I will introduce the team. Janet Myers, PI, Greg Repcook, co-PI, Carol Dawson Rose, Liaison for Substance Use, Parya Saberi, Liaison for Telehealth, Beth Perdue, Project Director, Kim Koester, Qualitative Evaluator, Andres Majorana, Lead Qualitative Analyst, Starlee Shade, Quantitative Evaluator, Mary Guzet, Lead Quantitative Analyst, and Michelle Palomares, Quantitative Analyst. And now I will pass it to Joseph.
Great, thank you, Marcel. All right, next we're going to get into the meat and potatoes of things. So let's jump into an overview of the funding opportunity. So as you can see, the goal of the 2IS initiative is to improve health outcomes for people with HIV through the identification and pilot testing of innovative intervention strategies in these 4 focus areas. We'll return to a more in-depth discussion of the focus areas shortly, but let's first go into the purpose and the structure of the initiative. All right. Already, the CCTA has been quite busy this year. We've applied the HRSA-HAB implementation science framework to identify the innovative intervention strategies. In October of 2021, the CCTA convened the Intervention Strategy Selection Advisory Council, which was comprised of academic experts, service providers, and community members. The council deliberated and recommended the intervention strategies that have ultimately been included in the RFP. Through the RFP process, the CCTA will select a cohort of 20 Ryan White funded organizations, each of which will pilot one of the selected interventions within their community over the course of the initiative. The CCTA will provide technical assistance to support implementation through varied required channels, including an initial training with subject matter experts on the intervention strategies, routine monitoring and cohort calls, yearly site visits, and twice yearly learning sessions. Finally, the CCTA plans to develop accessible dissemination products, which will promote the replication and scale up of the intervention strategies in HIV service delivery organizations nationally. Next slide. All right, here you'll see a high-level overview of the funding opportunity. One of the most important things I'd like to stress here is how quickly this initiative will move. Selected sites can expect funding to begin May 1st of 2022. From May to July of 2022 will be the formative phase during which sites are expected to hire or transition program staff and to develop programmatic processes and structures. Sites will begin the implementation and enrollment phases approximately August 1st of 2022. Sites will continue enrolling participants into the multi-site evaluation until July 31st of 2024, and will continue submitting data to the evaluation center through January 2025. In the final months of funding, the CCTA will support the site's development of sustainability plans. Funding for sites will end on March 31st, 2025. Sites can expect to receive a maximum of $190,000 per year. And for more information on funding and on budget development, please do refer to the budget template document that is linked in the RFP PDF. All right, next slide. So let's go back to the 4 focus areas that we mentioned earlier. The selected intervention strategies have shown promise in improving health outcomes across the HIV care continuum in 3 priority populations and 1 area of opportunity to improve service delivery. Those 3 priority populations are people with substance use disorder, LGBTQ+ youth, which for this initiative are folks aged between 13 and 24 years, and people who are or have been justice involved. And the area of opportunity to improve service delivery is using telehealth services with folks with HIV. All right, next slide, please. Yep, and we'll jump into the intervention strategies now. The intervention strategies housed under each of the 4 focus areas vary in scope and size, from client-level peer navigation programs to strategies that focus on instituting organization-wide change. When deciding which intervention strategy is most appropriate for your community and your organization, it's really important to review the information included in the RFP appendix. I'll note here too that some interventions will require applicants to provide additional information in their proposals. For example, we ask that organizations applying to implement one of the justice-involved interventions to demonstrate pre-established memoranda of understanding or MOUs with a local jail. And just a small note here, we note the link to intervention here. The full title for that intervention strategy is actually Youth Services Navigation Intervention for HIV Positive Adolescents and Young Adults Being Released from Incarceration. Right. Next slide, please, Ms. Silva. In addition to the information that the CCTA highlighted on each intervention strategy, each entry within the RFP appendix includes a link to the Target HIV website, where you'll find relevant background research and implementation materials. And just a friendly reminder, you don't need to create an account or log in to access those materials. And with that, I'm going to pass it back to Ms. Hill.
Thank you, Joseph. And now I will discuss applicant eligibility. To be eligible, you must currently be a funded Ryan-White HIV/AIDS program recipient or subrecipients, providing direct services inclusive of sites providing core medical services and or support services directly to clients. Not currently implementing the same or a similar intervention as the one selected under this RFP for funding. Must demonstrate a pre-existing relationship with an outpatient ambulatory health services provider or in-house OHS that will be able to collect and report to the applicant viral load tests, retention, antiretroviral treatment adherence, etc. Now we'll discuss the site selection. To be eligible, sites should have the ability to reach and serve the population that they have selected to serve, have readiness to implement the selected interventions, ability to collect data for evaluation, and demonstrated financial ability to support the project in the period between incurring an expense and receiving reimbursement from the 2IS CCTA, typically 30 to 60 days. Furthermore, an advisory committee of community leaders and experts in HIV intervention strategies will individually review and score the applications. The CCTA may conduct follow-up interviews with sites as needed. The advisory committee will convene to discuss the applications and make recommendations for site selection. The CCTA Evaluation Center and Hub will decide final cohort of sites based on recommendations. Here we have a map from the Department of Health and Human Services throughout the country. An attempt will be made to distribute funding to implementation sites across HHS regions of the country. And here's our timeline. The RFP was launched on December 3rd. Today, we're having the TA webinar for the RFP. The RFP is due on January 12, 2022. Notification of awards is March 15th, 2022. Funding begins on May 1st, 2022. And finally, our first convening will be in August 2022, hopefully in person. Now let's discuss how you can apply. Here's a checklist. Please ensure you have the following: grant application information, project narrative, project budget, template, current annual operating budget, audit, board of directors list, diversity table, memoranda of agreement, or letter of support. AIDS United's online grantee portal is the platform we use for grant submission. It is important applicants use Google Chrome, Firefox, or Safari for internet compatibility. Do not use Internet Explorer or Microsoft Edge. Text must be entered into all required fields to save the application or progress to the application tab. To monitor page limit, complete the application in Word before submitting online. Be sure to paste as plain text into the system. Now I will introduce you to Shannon, who works at AIDS United and will provide technical assistance during the webinar on how to apply.
Hi folks, thanks Michelle. My name is Shannon Weiss. My pronouns are they, them, and theirs, and I'm the Senior Grants Manager at AIDS United. My principal role related to our applications is to help anyone who might need assistance with the online grant application system. So I'm going to go ahead and share my screen and give you an idea of what the process looks like. And I want to say hi because there are some folks on this call who I know. So hi if I know you, and if I don't know you, I hope to meet you electronically at some point. And yeah, oh, and for those of you who've already been through our system, my apologies that you are going to see it again, but this will not take long. So when you go to log into AIDS United system, you're going to see this page. This is the page you're going to log into. And then you're going to proceed to the first page, and I'm going to use a different browser to show you what the system looks like when you're in. So when you are logged in, oh, except my window popped over to another browser. So hold on a second. All right, here we go. Bring it back over to this window where I had put it, but sometimes our technology has a mind of its own. There we go. So when you log in, center it again. See, I was so ready at the beginning for this, and all right, there we go. So when you log in, you're going to see our home screen, which is right here, and you are going to see 4 tabs across the top. And these 4, I've got 2 others because I have I have access to a couple other areas of this grant management system that most folks don't have. So you're going to go to funding opportunities, and you will see this open funding opportunity for 2IS right here. You may or may not see this invitation only. If you were invited to submit a Southern Fund application earlier this year, you might see that, but if not, you won't. So don't worry about that. You're going to want to go here. And you're going to see some information on this page. All of this information is pulled from the RFP. You can skim it if you would like. There's a reminder down here about when the deadline is and who to go to for assistance. That would be me. If you have questions about the online system, and then the reminder of sort of what you need to do to apply. Over here, you'll see a summary of all of the attachments that you need for the application. You can click here to view all if you'd like to, but we're going to skip that for right now. And then you're going to click apply now. And you're going to get a window that says, do you want to apply? And of course, yes, you do, because you clicked apply now. But this is the way that our system makes an application record. So you're going to click yes and click next. And then you are going to get a little window. It's going to tell you you've successfully started your application. You're going to navigate, it tells you to navigate to your My Applications page, and you're going to select this application. You want to make a mental note or a quick, scratch pad note of this number 6316, because you're going to need that. You're going to click Finish. And then as that little box said, you're going to go to the My Applications tab up here. And this is where you're going to access your application. So you'll see I have a bunch of applications. Your application will likely show up at the bottom of this list, but if it does not, go to View All, and you can see all of your applications. You see all the tests I do to get stuff going here. So yours will be at the end of the list, either on that first page or this page right here. You're going to open it, and then you're going to see multiple tabs here. So there's a couple of things to do. One is to take a quick look at tab 1, which has your organizational contact information. And if you have a fiscal sponsor, the information here. If this information is not correct, please click any of these pencil icons, which will open the entire form to editing. And please fill in your accurate information and click Save. That will update our database with your contact information. You're going to skip tabs 2 and 3. You're going to go right to tab 4, which is where your application narrative is. So it says here, your form is going to load momentarily, and here we go. Your form is loaded. So this first page has a little kink in it, and that there's usually an email field here that has your email address usually already defaulted in. That email field does not always show up. I haven't figured out why, nor have our contractors. So if you see an email text field, you'll need to make sure it's filled in. It's required. And if you don't see it, just go ahead and click Next. And then you're going to land on the first page of the application in our system. And you're going to go through these questions and respond to all of them. But instead of having you watch me fill this out, because no one has that kind of time, I'm going to go here. I fill out all the pages of the application, and you're going to get then to this page that says you've reached the end of your narrative. You can go ahead and keep making changes. You can save and come back to this later. There's also this Save My Progress button on all of our other pages, which you will see in the first part of your application. And if you want to submit, I'm going to show you what the submission process is. So this is the first part of your submission process. So you're going to click that you wish to review and submit your narrative. You're going to click I confirm. And then this red Review My Narrative button is going to show up. You're going to click this button. You're going to get a brief glimpse of a Submit button that's going to show up here before this dumps you back at the first full page of the narrative. And so there's that number. You go back here, and you're going to check to make sure that all of your answers are correct. You can see I've just put in, characters just to get through the form. You're going to double check all of the pages. Usually, this is where Save My Progress button is showed up. That button disappears when you're doing your final review, and you're going to click next to all of the pages, scroll up to make sure you filled in and answer. You don't want to submit if you just put in the number 1. You want to make sure you have an actual response, and anything with an asterisk is required. So I put number 1s in things so I could show you the submission process. And we're just going to keep going through these pages because you don't want to watch me scroll up constantly. And here we go. So now we're going to get back to the same page we were at before. And this red Submit My Narrative button is now active, and you can use it. So once you know you want to submit, you're going to click this Submit button, and this is going to ask you, are you sure you wish to submit your proposal? And you're going to verify that yes, you do. There's a reiteration of the CCTA email address, just in case you have any questions about the actual content of your application. And then note that this red text here says you must hit submit at the bottom of the following page for your application to be fully submitted. So you're going to, again, confirm that you want to submit. You're going to click Submit My Narrative. And then this screen is going to show up. And what this screen does is this creates a PDF of all of your responses. And this PDF is what reviewers will see. So this is why there is this third step that seems completely unnecessary in here. It actually is here. You can skim your answers if you want to. You've checked them all in the previous step, and then you're going to click Continue. If you save your progress of your proposal at some point before you submit, you will see this same window come up, and you're going to click Continue. It's why it says Continue and not Submit, because this button functions both for if you're saving your application to come back later or you're submitting, and the program knows what to do because it's smart, because you hit a button that says Save or Finish Later or Submit, so it knows what to do. So we're going to hit Continue, submitting your form, and then you're going to scroll up and you're going to see a confirmation that your narrative has been submitted. So there's two other things to do to submit. Go to this More tab. If you have a narrower window, you're going to go to 5. Tab 5 is where all of your attachments are, and they'll take a second to load. You'll want to click View All because you'll see there's more than 6 tabs, right, or attachments, excuse me, right there. So when you go to View All, you're going to see all of the attachments that are a part of this proposal. You'll see whether they're optional or required, and you'll see the status. So you'll see that there's a submitted attachment for your submitted narrative. And this is that PDF that I mentioned that is going to be shown to the reviewers of this process. All the others say pending application submission, which means you haven't attached anything here yet. So I'm just going to walk you through one just to show you what it's like. I'm not going to do all of them. So when you click on an attachment, you're going to see here that it's pending application submission. This has a note that using the provided template is required, and you'll see that there's a template link here. This is the template for our representation table. This representation table link also shows up on the RFP webpage and might also be linked in the RFP itself. But if you have not gotten it before this point, you can download it here. And then when you're finished, you upload here either by clicking, by dragging and dropping, or by doing an upload. And I'm just going to go grab an AIDS unit. Oh, no, I'm not going to grab a document here. So we're going to attach that, and it's going to tell you that it's uploading. And then when it's finished, you can either click done, or you can just hit the back button to go back to your attachments. And then you're going to see that it shows that one application, the one attachment has been added to the representation table. All of these attachment fields can have multiple attachments. Now, please do not give us 3 versions of your representation table. We only need 1. But for things like your memoranda of agreement or understanding or letters of support, as well as possibly other supporting documents, and that's an open category depending on what you might need, you can upload multiple files to these. And then this will not say 1, it will say however many files you've uploaded. So when you've finished uploading all your attachments, to get back to your application, you can either click the back button on your browser, or you can click this application number here. And it's going to take you back to this, and you're going to go to submit. And this is the final submission of your application. This has a little bit of explanatory text up here. You're going to want asking you, are you sure you wish to submit? You're going to click yes, and then you're going to click next. Now, it's not going to submit for me. It's going to give me an error message saying, hey, you haven't attached all of the things you need to attach in this application. So make sure if you get this, that you go back to tab 4 to make sure that your narrative is submitted, and then to go back to tab 5 to make sure all your required attachments are submitted. And then when you submit again, it will say you'll get a very quick thank you for your submission notice over here on the side, where now I have a couple sentences telling me that I didn't do everything I needed to do. You will get an email from the system as well, notifying you that your submission has been received. If you do not receive that email, please drop a line to me. My email is S as in Shannon, WYSS, my last name, at aidsunited.org, just to confirm that you've got everything submitted the way that it should be. There shouldn't be any problems with the system, but things happen. And again, I want to reiterate what Ms. Hill said earlier. Please don't use Microsoft Edge or Internet Explorer. They don't play well with many online systems, including ours. So please make sure you're using Safari, Firefox, or Chrome. And with that, I'm going to turn it back over, I believe, to Ms. Hill, and I'm happy to take any questions folks have during the Q&A period. Thanks, everybody.
Thank you so much, Shannon. Again, as explained earlier, if you have any questions, please email Shannon, and they provided their email address, and you can also see it in the slide. You can also email the CCTA at aidsunited.org. We prefer that you submit questions and requests for assistance via email with your organization's name in the subject line of the message. This webinar will be placed on AIDS United landing page by 5 p.m. Eastern Time. And now we'll move on to the Q&A portion of this webinar. Brian, can you read out loud the first question? Brian will be passing on the question to the respective person that may answer or able to answer the question.
Hi, Marcel. So we had two questions that were in the question and answer box that we were able to answer inside the chat, but I'll go ahead and read those out for folks. One question was if you have recently received Ryan White funding, but are not a current Ryan White grantee, are you eligible or must you have an active Ryan White grant at the time of application? And the answer to that question is you must be an active recipient or sub-recipient. The next question that we had was about the requirement of the 75% data manager and 25% backup. Will the grant need to pay for these positions or can they be leveraged from a larger project? And the answer to that question is the grant should be sufficient to pay for these staff members. However, the sites are able to include in-kind staff as well into their budgets. We just need to make note that those staff will provide in-kind support. I don't see any other questions in the chat thus far, but if you do have any, please, by all means, either type them in the chat or utilizing the question and answer function. Back to you, Marcel.
Marcel, if I could jump in quickly. Shannon, while we're waiting for folks to share new questions, are there any tips and tricks, or are there any common challenges that folks experience when going through the grantee portal that you might be able to address here?
Yeah, good question. Thanks, Joseph. So I would say for tips, someone had mentioned, Marcel, I believe, had mentioned working in Microsoft Word or Google Documents or some similar to save your responses beforehand. And partly that is to monitor the length of your application. And that's also so that, if your computer or internet browser crashes, you have stuff saved elsewhere. The saddest thing in the world is for someone to get to the end of their grant application where they've been composing all of their responses in the browser and their browser crashes or their internet service provider goes out. And that's just it makes you want to cry. It makes me want to cry. And I wasn't even doing the work that you all have been doing. So please don't let that happen to you. Please write your responses offline. And this is not just for AIDS United system. This is for any online system. Write your responses offline. Do keep track of the length of your responses. And if your responses are under the limit, go ahead and try to paste in with all of your formatting. But if you're formatting, if you're over the limit, try to eliminate your formatting. All the fields will allow, all of the longer fields will allow formatting to be added. And it's kind of nice to look at italics and bold and underlines and bullets and things like that. So try it. If it doesn't work, go ahead and take your formatting out and then submit. I will say that the most common challenges folks have come across is things like their answers not showing up. They put a response in and it's not saved at the end. And that often is a function of using Internet Explorer or Microsoft Edge. So if you stick to those approved browsers that are much better working with online forms, you should not have an issue. But again, if you do, please don't hesitate to write me. I'm super good on email. I will say that I do generally work 7:30 a.m. to 4 p.m. Pacific time. So if you write me outside of those hours, I probably will not get back to you. But otherwise, I'll get back to you, the next business day. And if for some reason I'm out of the office, we do have the winter holidays coming up, or more winter holidays coming up, I should say. I'll be out some for that as well. But I'll have an auto reply on my email address, svis@aidsunited.org. That will let you know when I'm back, when I'm going to be back to help answer your question. If you come up with a technical question and I'm out, you can go ahead and try sending it to the CCTA team. They might be able to help you out as well, and then you don't have to wait for me. If you do that, if you think about CCing me when you forward the email to the CCTA team, so when I get back, that your response has been taken care of, because they'll keep me looped into the email thread. But yeah, I'm always happy to help folks out. So please let me know if you need anything. Back to you, Joseph.
Great, thank you, Shannon.
You're welcome.
All right, I'm seeing a question in the Q&A, which I can go ahead and respond to here. Will there be coverage for the PI? And the short answer is yes. So in that budget attachment that we talked about earlier, you'll be able to list out each staff person, including the PI or the project manager, list out annual salary as well as your expected FTE on the 2IS project itself. The form is set up so that it would automatically calculate based on those two categories, annual salary and FTE, how much money you would be requesting within the 2IS specific budget. So yes to PI coverage. All right, Brian, do we have any other questions coming through? I do see Carlos Carrero, your hand is raised. All right, you should be able to ask your question.
Okay. Can you hear me now?
Yes.
Hello to all. Yes, if we're interested in the services for youth, LGBTQ youth, in Puerto Rico, care for people under 18 years of age must be provided by a pediatrician. And we don't have pediatricians on staff. Can we partner with an external pediatrician to manage the clinical care for those under 18? Or does it have to be an on-staff pediatrician?
Yeah, that's a great question, Carlos. The short answer is yes, you can partner. What we would recommend is that within your application package that you do include formal documentation of that partnership and the scope of the relationship with that pediatrician. We would ask that you are able to demonstrate that you would be able to get any required data components from that person as well for each client who is enrolled in the initiative.
Thank you.
Sure.
I'm going to jump in briefly while we're waiting for any last minute questions that might be submitted. I forgot two things to add. One, there's a applicant guidance document that is a link to the RFP webpage. You can also get that by emailing the CTA team or me. It is approximately a 20-page PDF, but that is only because it is lots of screenshots. 3/4 of the document is either screenshots or blank pages or blank parts of pages, so that the screenshot and the text can be all included together on the next page. So do use that. If you need any assistance with the system, you might want to, if you haven't used our system before, just start with it anyway and keep it on the side of your screen available. And then if you do have an issue, when you write me, please let me know which web browser you're using, what happened that you didn't expect or that shouldn't have happened, and then please send me a screenshot if you at all can of what happened. If you don't send me those things, I will probably ask you for them. So, head off an email and just send them to me off the top, and then that'll help me troubleshoot with you a lot. Thanks.
Great, thanks for that, Shannon. We do have another question in the Q&A box, which I'll respond to here. It reads, I am an investigator affiliated with an academic medical center. I work closely with a community clinic that is Ryan White funded, but not paid through them. Would I be able to apply as a project director and funds and the project go through the clinic to support services? This is a great question, very similar to what Carlos was speaking to a little earlier. What I would recommend is that you work with the Ryan White funded clinic that you described so that they are the primary applicant and that you work with them to establish what your working relationship would be through the project, perhaps through a memorandum of understanding, again, with the demonstrated ability that you would be able to provide any of the data points that the evaluation center would need to collect from any enrolled participants. All right. Brian, do we have any other questions?
As far as I can see, those are all the questions, as well as I do not see any other hand raised in the attendees section.
Great. All right. Well, we'll give folks another couple minutes to ask any questions that come to mind. Certainly, again, my name is Joseph Stango, Senior Program Manager My contact info is included in the RFP document along with Shannon's. If you run into any questions as you're working on your application materials, I'm more than happy to support you all as you begin to craft your narrative, begin to think through what your implementation strategy might be. All right. So why don't you go back to the contact slide? All right. Again, if you have questions about the submission process after the webinar, feel free to contact Shannon at their email address listed here, or the CCTA generally, ccta@aidsunited.org. Let's see. Thank you, Sandra, for the kind words. All right, since we're not seeing any questions come in, I think we can go ahead and end our webinar here. Again, we're very excited to have you all work on these applications. We're excited to begin to craft our cohort for the 2IS initiative. And thank you all for joining us this afternoon.
Thanks so much, everybody. Have a great rest of your day. Stay safe and stay well. Bye, folks.
Bye, everyone.